Hi, I'm Dr. Albert Chung and welcome to Your Friendly Proctologist. In this space, we discuss your bottom end health. And in this time, I hope that you can relate or learn a thing or two. I want to thank you again for making it this far in this video series of treatment of an anal fissure. My plan is huge, and with my plan, I'll tell you that I can avoid surgery in pretty much 95 to 98% of patients. I'll be frankly honest with you, I have not done an anal fissure surgery in 5 years, okay? And that's because my formula is so successful. Let's move on with our series, shall we? The other parts that I want to focus on today is to focus a little bit more on that exercise piece that I finished discussing in that last video. A great exercise that I recommend is the Kegel exercise. I kind of sound like a physical therapist, but this is a great thing. You can look up Kegel exercises on the net, but let me share with you one way that they can be done. Obviously, the positioning, it doesn't matter. You can be sitting in a chair. Focus first on your anus and squeeze your anus like as if you were holding in a bowel movement. So you're trying to focus on the center of your pelvis. Don't contract your butt cheeks, just your anus. If you find yourself making your buttocks tight, start over again. Relax everything until you just get your anus. Next, continue that contraction. Try and persist with that squeeze. And if you need to take breaks, it's okay. But try to keep that contraction going. And what you'll find is that contraction will keep getting stronger and stronger with time. And when you get that stronger contraction, you're going to feel some tightness going on in other parts of your pelvis. It may feel deep inside, maybe at the bottom of your belly. It's going to feel a little bit odd, maybe even a little bit shaky. And sometimes you're going to feel like it's going forward to your urinary system too. And that is all part of your pelvic network of muscles. Once you get to that top peak that you find that you get to, hold that for about 1 to 2 seconds. Then relax, and relax slowly as much as you can. And you'll see that when you get better at this and you practice this, the levels of relaxation that you will achieve and the levels of contraction will get lower and higher respectively. And that Kegel exercise there is an excellent one in order to repair muscles, strengthen them, and also to really understand how your pelvic system feels, and also help with your anus muscle so that you can continue to allow that fissure to heal. What's another piece of anal fissure treatment? I believe this is the most important one. It's your story. Can you believe it? A doctor is saying, listen to the patient, okay? What the patient tells me is the most important, because not every formula works like an instruction manual. People live different lives. People come from different cultures, backgrounds, different foods, whatever. You can think of a million ways people are different from the next. But I always open up when they come in and say, please tell me your story. A lot of people go from the beginning, and then they go chapter by chapter, page by page, and tell me what's been going on. And from that, I come up with a customized plan. You won't believe some of the things which I can't share in this video for patient privacy concerns. I think that's an invasion of people's privacy. I'm not about to capitalize or, make myself popular of some people's stories, but you won't believe some of the habits that people have that they didn't realize was actually making that fissure persist.
And of course, this doesn't go for just fissures, but really everything about the bottom end health. Sometimes it's a little bit difficult to uncover, but that's why I have the time to go into these particular things in detail. Like, for example, I'll hear one statement that a patient says. I'll ask follow-up questions. We'll discuss it for about 15 minutes, and I'll find that at the bottom of it, there is something that's going on that we can attack that. This is a problem where, yes, the fissure was a symptom of a larger issue a patient was having sometimes. Sometimes needing to get something out, sometimes it does kind of feel like a therapy session, you might be thinking. Yeah, sometimes it's kind of like that, but like I said before, the anus holds a lot of stress for people, and that's where sometimes even medication, you've seen it. Medication doesn't work for everybody. Why? Why is it, why is there so much variability? And sometimes when people find out what the true underlying problem is, don't treat the symptoms, treat the problem. All the things that we've talked about, sometimes it's about stool softening, but why is it not as simple as just drinking more water and taking fiber? Why? And that's where the discussion and, in my opinion, truly playing doctor, okay? Because I don't just see an anal fissure and then look up in the textbook and then spit out what it says word for word. That's not human medicine. We're not treating a robot. It's a human being with not just a cut, but it's maybe due to a constellation, so many different reasons. It may be twisted. The story may even go back, many, many years for a person, etc. And so you see how complex it can be, but I believe that this is the most important factor for people. And the next video that I would like to share with you has to do with surgical treatment. And like I said before, I believe that surgery should be used as a last resort. Surgery, in my opinion, can be avoided. And with my recipe and my techniques, I find that 95 to 98% of these patients do not require surgery. And we'll go into why, and we'll explain a lot of different things to you, or I will. And once again, please like, subscribe, please ring that bell if you want to learn more. And more videos are coming soon. Take care. Bye-bye.